Arlene, what do you think meaningfully can be achieved by a group of young people coming over to Brussels and trying to do something like this?
Well, I mean, firstly, I think that it's a fantastic campaign and we really want to give it our backing because they have such a lot of energy, they have such a lot of passion and commitment. And let's face it, this is about the future of the Northwest region. It's about the future of the UK, but it's also about the future of our region. We have the second highest death rate from cardiovascular disease, lung cancer, so smoking-related diseases. It's a big drain on the health budget, and I think the fact that these young people are taking up the campaign for a smoke-free future and a healthier future for our region is something certainly we're going to back. And what I find in this Parliament from many of the campaigns that we've won on is that people power works, and in this case it's young people power. So we are going to be helping them to get petitions done, to influence the key decision makers in this place, to work with other groups. Hopefully they can link with other youth groups across the EU, because we're talking about the generations in the future. We're talking about cutting back a lot of our health bills for smoking-related illnesses. We're talking about saving young people from untimely and pretty horrible deaths when we're talking about lung cancer or heart disease. And I really think they deserve our support.
Do you get many young people coming to Brussels and doing this sort of thing?
No, and we want to encourage more young people to come and talk to us about what matters to them. I mean, we had quite a big youth campaign involved in banning cat and dog fare. The Commission told us then they couldn't do it. We said, well, if people want it and young people want it, we want you to do it. And we found a way to do it. And we have now banned the import of cat and dog fare because of the cruelty of that right across the EU from December 2008. So we can have action. And I think these young people's voices are going to be really significant to us achieving results and an outcome in this area.
What did you think of the quality of the presentations and what will you actually do next?
Well, they know their issues very well, and I was really surprised they know a lot about tobacco farming. They know about the subsidies that we have been fighting against for a long time in this Parliament. We believe it's not right to put so much money into tobacco growing in places like Germany, France or southern member states, where the quality of tobacco we know is then exported to children, 11-year-olds in the developing world. So they know the facts, they know the issues, and I think really, as I said, they deserve our support to help them take this camp forward, and we're going to be giving them all the help that they need. I thought the campaign they have on toxic films, the campaign they have around getting smoking out of the images in films, well, again, I hope that we have the contacts, the connections to help them get that message across and to open doors for them as well.
Gina, what were your expectations when you came over here, and how has what you've actually experienced matched that?
Well, we really wanted to talk to MPs and see what they would do for us if we asked them about what we feel strongly about in terms of tobacco control. And we've had a great response, especially from the Labour MPs who have promised to put us in touch with other organisations and support what we want to happen within the European Parliament, as well as the Framework Convention on Tobacco Control. And we've also had a meeting with Conservative MEPs where they've given us more suggestions on what we should do to help our policy become more European Union friendly in terms of EU-wide measures.
What was it in terms of, does it match your expectations, or did you not know what to expect?
We didn't really know what to expect. I mean, we knew that we'd meet with MEPs, and we knew that there was already the Framework Convention on Tobacco Control in place to help us on tobacco advertising, but we weren't really sure how our MEPs would react. We've had a really good response.
Okay. Any differences between Labour and Conservative that you'd pick up?
The Conservatives seem quite reticent to actually commit to any policy of ours, but Labour MEPs have been very helpful in putting forward organisations that we can get in touch with and saying that they'll support our ideas in the European Parliament.
Did they all seem interested?
Yeah, they all seem interested. I mean, even the Conservative MEPs were shocked by some of the statistics, like young people are 3 times more likely to start smoking if they see smoking in films, which is what DMIS was focusing on today.
Yeah. Okay. Can you tell me a little bit about what Smoke Free Northwest is all about and what the objectives are?
Smoke Free Northwest is committed to breaking the intergenerational cycle of tobacco-related health inequalities in our poorest communities across the region. In order to do that, we need to do something about young people taking up smoking. We're doing really well at supporting adult smokers to quit, but the numbers of young people starting to smoke hasn't changed now for many, many years, and we need to do something about that.
Because perception would be that in society generally less people smoke, there's a smoking ban, people are more enlightened. We don't think that's affecting young people.
No, I mean the rates of uptake of smoking in young people haven't changed over the last 10 years really in the Northwest, and actually rates of smoking in young women have increased.
What's driving that?
I think it's a very complex issue, but a lot of the role models that young women have, models, actresses, musicians, many of them do smoke, are often photographed smoking, and that's a role model that young women aspire to be.
Okay, and in terms of the Northwest versus any other part of the country, have we got bigger problems?
We absolutely have got bigger problems. You know, we have real health challenges with health inequalities in the region, and much of that, more than half of it, is related to smoking.
Bringing all these young people out to Brussels, what did you hope to achieve from that?
I think if we want to change young people's smoking, we need to talk to young people themselves. We need to understand what it is that motivates young people to start smoking, and we need to understand what their views are about how we help them to stop.
Okay, and in terms of the impact they had on the MEPs, do you think it's going to make any difference?
I do think it's going to make a difference. You know, many of the MEPs that we spoke to were really keen to support the young people's work. They wanted to get involved, they wanted to get engaged.
And what happens next?
What happens next when we get back is that we get in touch with the MEPs, we look at what we can do together at a European level, we reach out to young people's groups across the EU, and we work together to make smoking history for our children and young people.
And do you feel that young people would have more of an impact on those guys in there versus, I don't know, you going over and having a meeting, or politicians in the UK trying to achieve something?
Absolutely. Young people tell it like it is. You know, they say that they can buy illicit tobacco in their schools, in their communities. They say that smoking in movies, smoking in the media, smoking in magazines, they say that it influences them. You know, this isn't about, you know, what we as the public health community are saying. Yes, there's an evidence base. Yes, there's lots of research out there, but this is young people telling it for themselves.
Brilliant.
That's it. Okay.